Well, welcome to the Botanical Medicine Study Course with me, your host and instructor for the online course in Botanical Medicine of the same name as this channel. My name is Stephanie Georgiev. Many thanks to all of you who have subscribed, liked, and shared these videos, and to those of you who have downloaded the free introductory video and handouts for the upcoming course, which will begin unless the end of the world happens beforehand, which is a day-to-day curiosity if that actually happens. The course should start in the beginning of 2024. Apologies to those of you who are waiting for the course to begin, but as the book states, a series of unanticipated and unfortunate events have created a bit of backlog in terms of content creation on my part. Keep in mind, it takes quite a bit of effort and logistics to create a course, which I am compiling, that will teach you how I wish I had been taught. But never fear, classes like winter are coming. And what better time than the new year to start a resolution to learn how you can become healthy and help others to be more healthy with botanical medicine. Link below to fill out a form and download the videos and handouts. So, for this week's Herb of the Week, we're going to look at a few herbs in honor of what I like to call Breast Health Month. Who wants to be aware of breast, quote unquote, C? How we talk to ourselves and what we focus on truly does affect our well-being. So for years, when I was either in solo practice or part of a group practice, the entire month of October was filled with lunchtime talks and special health fair, all focusing on how we women can have healthy breasts through nutrition, supplements, self-care, and of course, botanical medicine. Now, when I first started my practice way back in the last century, my personal and professional opinion was that a person had an equal chance of dealing with cancer naturally as they did surviving things like radiation and chemotherapy. My amusement and irritation was that all of my breast cancer patients were getting regular care and would come to me with advanced tumors. They told me they had been diagnosed a year before and were told by their doctors they would watch the tumor. I always wanted to ask, watch it do what? Cartwheels? Thankfully, oncology or the science of cancer treatment has evolved quite significantly. Diagnosis of tumors and what sort of chemotherapy to use, much more targeted than it used to be, supportive therapies and targeted doses of radiation are much more humane, effective, and do not take as much of a toll on the body as they did in days past. I always tell my patients to pick something and stick with it. Jumping around from therapy to therapy is not a good idea. Nowadays, women can find integrative medical practices which combine things like acupuncture, nutrition, psychotherapy, along with surgery, chemotherapy, and radiation. The results, I must say, are impressive. All forms of medicine can agree that prevention is the best bet. And the best prevention is actually through self-care, such as monthly self-breast exams. I have a link below on how to do that if nobody's taught you how. And it's also significant that most women usually find problems with their breasts way before their healthcare practitioners. And that's because they do monthly self-breast exams and they find things, a lump or a bump, and they go and get it confirmed through various diagnostic methods. So this is one way of prevention through self-breast exams that contribute to early diagnosis, or through various diagnostic methods, nutrition, exercise, avoidance of harmful behaviors such as drinking too much alcohol, smoking tobacco, and avoiding carcinogens when possible, such as if it's possible for you to move from a toxic area or to stop eating too much industrially produced foodstuffs. And I want to make a deep, contrast between certain food items and industrially produced ones. For instance, dairy products. If it's industrially produced, this means you're getting a ton of extra hormones, you're getting a ton of antibiotics, both of which contribute to not so great health outcomes. So definitely try to avoid those things, but organic and things like grass-fed and pastured dairy is not as toxic. So it's not dairy, it's how the dairy is made. Now, the other thing you can do is you avoid pesticide-laden produce as much as possible. So this means grow your own or find a good source of organic produce. And I can't tell you how important that is. Now, all of these things will contribute to healthy breasts, healthy bodies, but also healthy breasts. Now, if you or anyone you love has a history of breast cancer in the family, especially through the mother, it's a good idea to get a BRCA, BRCA genetic test. And I've included a link to an article from the National Institutes of Health on how these genes, the breast cancer genes, and how they relate to breast cancer. Now, my sister-in-law suffered from breast cancer during her second IVF pregnancy and had to have lumps removed while she was pregnant. And then after the pregnancy, she developed full-grown breast cancer and had to have a mastectomy. My niece had the BRCA test done, and thankfully she does not carry this gene. So it doesn't mean she doesn't pay attention to self-care, but it also means that she's not at a higher risk for breast cancer. If you test positive for this type of gene, it's wonderful information, which means you have to be very diligent about self-breast exams, also regular checkups, any type of diagnostic therapy you want to use, and also pay great attention to your nutrition, your stress levels, and reducing your exposure to toxic substances. Now, when women are undergoing orthodox treatment for breast cancer, their oncologists usually want clients to refrain from vitamins and herbs completely. And the thinking is, whether or not anyone is aware of it, that supplements and herbs are quite good and effective at combating destructive influences on the body. And chemotherapy and radiation, even when gentle and targeted, can actually be nullified with supplements and herbs, primarily because these therapies are destructive. They're killing cancer cells. And destroying cancer cells is the whole purpose of going through all that rigmarole. And why would anyone want to go through all that trouble and expense of such treatments only to take vitamins that would stop the destruction of the cancer? But one thing oncologists can all agree upon and allow their patients to do during treatments, with certain caveats, say for certain treatments, soy is a big no-no. But other than that, the one thing all oncologists can agree upon is good nutrition is very important for preventing cancer, during cancer treatment and also after the cancer treatment to prevent recurrence. And sometimes women experience great nausea during treatment, but thankfully, there are really good drugs that oncologists can prescribe to combat the nausea associated with chemotherapy. So for this week's Herb of the Week, we're going to be exploring more than just Herb of the Week. We're going to explore a few botanicals which can also be thought of and used as nutrition. In fact, all women, including girls who have started to menstruate, should incorporate these foods into their regular diets, regardless of your breast cancer risk, to improve the health of not only your breasts, but your entire body. Now, women produce breast cancer for various reasons, and it's often due to excess estrogen in the body. Another reason is what we call free radicals, which oxidize tissue and promote cancer growth. I like to liken oxidation of the body to like creating rust, because metals, when they oxidize, actually start rusting. And that's basically what these free radicals do. And this is why vitamins called antioxidants, like vitamin C, E, zinc, beta carotene, and such, and foods which are high in these substances are considered cancer preventatives, and in some cases are very important for treatment. Now, natural plant products have shown promising results as anti-tumor and anti-cancer agents. Their effectiveness is also reported through numerous studies as they help to decrease toxicity in general when they're used, and also help resistance to hormonal targeting anti-cancer agents. Such uses are due to the antioxidants and anti-inflammatory properties of these plants, basically. And they also help with the immune system. They increase the effectiveness of the immune system. And they also stop the proliferation of cancer cells and what we call apoptosis, which is the destruction of cancer cells. And all of these properties, these foods do in what we can call a chemopreventative property, which can be prophylactic, which means preventative, and therapeutic. And what's also wonderful about these foodstuffs is that you can use them long term, which is not true of all herbs. Now, this is a wonderful slide from my favorite go-to image source called ResearchGate. And it is showing a dietary sources of flavonoids. Now, constituents of natural plant products such as flavonoids, alkaloids, terpenoids, coumarins are known for their antioxidant and anti-inflammatory properties. And you've heard me talk about these things, such as in turmeric for the substance called curcumin, and also for how they activate lymphocytes. And lymphocytes are the things in your blood that are very important for your immune system. And so these substances are strong immune stimulators, which are very good at suppressing or fighting against cancer cells. So these are really important. And some active compounds in plant substances are called phytoestrogens, and they're also called isoflavones, and they can act as endocrine disruptors for hormonal disorders. And basically what they do is they mimic the hormone without the actual hormone, and they block the receptors and basically stopping the real hormone from acting on the receptor. Now, this is unfortunately, for reasons I don't understand, quite controversial, and that's why many oncologists recommend not eating things like soy. Now, because soy has isoflavones, there is also a substance called DIM, which acts in the same manner, and it's found in things like broccoli and other things. So, as I said before, some oncologists feel that soy can be a preventative for breast cancer, and other feels that it causes cancer. And again, it really depends on what type of cancer you have, whether or not you should eat such substances. So I leave it up to you, dear viewers, to do your own research and to talk about your ideas over with a qualified nutritionist, your oncologist, if you have one, and also your naturopath and acupuncturist. There are a couple of words we need to be familiar with before we explore these wonderful and delicious plants. One is called apoptosis, which you've heard me say a little bit before this. And this is a highly selective and ordered process of programmed cell death. Okay. And this is wanted for cancer tumors. We want to make these cancer cells do apoptosis. And the apoptosis can happen in physiological as well as pathological conditions. So this is obviously something desired when it comes to tumors and different types of cancer. And the other word you need to be aware of is something called metastasis. And this is when a cancer spreads to other tissues. So we want the word anti-metastasis. Okay, we want that when we're looking for what food substances do. Now, an amazing herb that you can eat a ton of, basically is supposed to inhibit vampires, but it also does really interesting things with cancer. And what's another property of all of the foodstuffs that I'm going to discuss here is that they've done extensive studies pairing them up with different types of breast cancer chemotherapies and noting that when you combine these herbs with breast cancer drugs, they tend to make everything, including the herb, more effective, which I think is very hopeful and very wonderful. And you just have to put these in your food. Now, garlic, which is also called Allium sativum, it decreases tumor growth. It promotes apoptosis. And it also prevents oxidative digression. So it's an antioxidant. And it promotes anti-tumor proteins. And it's just a wonderful, wonderful herb. And I personally can't get enough of this. And I have put a link to make this wonderful thing that you can get at a lot of farmers markets in North America. It's basically a garlic spread that I could just jump in and eat my way out of the vat. It's so delicious. So I have that recipe. And just a note of warning, definitely use a food processor, because if you use a blender, you're going to have highly garlicked oil rather than making a wonderful garlic mayonnaise type thing. And it's vegan, if anybody's curious about that. Now, turmeric, which for those of you who watch this channel, and you can look up that video, it's called Curcuma longa is the botanical name, and the active constituent is curcumin. And curcumin is recognized as non-toxic and safe. Its therapeutic benefits are due to its anti-inflammatory and antioxidant effects. Studies investigating the anti-cancer activities of curcumin on breast cancer involves targets, and it goes directly for the tumor, apparently, and it inhibits cell proliferation. It triggers apoptosis, and it also stops a inflammation cycle in the formation of cancer. So it's really, really a delicious and wonderful herb. Now, the next one is burdock. It's Arctium lapa. And the active constituent in this is called arctogenin. And this induces apoptosis, and it has anti-metastatic properties. The Arctium genus is comprised of 200 non-volatile compounds, which include and are not restricted to lactones, lignins, flavonoids, quinic acids, phenolics, terpenoids, and polysaccharides. Now, lignins are the biological active component of the arctium that, as we said before, includes arctogenin. And this is actually a phytoestrogen, and its presence in the leaves, the seeds, and the roots, but I'm only recommending doing the roots of this. And burdock is great in stir fries, and I've listed a link on what to do with burdock root, just in case you don't know what to do with that. Now, flax seed is my new best friend. I am doing everything you can possibly imagine with this substance, mainly because I'm older and my colon is very sleepy these days, but also because of that, I'm trying not to eat a lot of flour products, meaning breads and pastas. Even though I'm not gluten intolerant, I'm just finding the less flour that I eat, wheat flour, the happier my colon is. And so I'm learning to do all kinds of fun things with flaxseed. And the reason why these are so good for preventing and treating breast cancer is these lignins, which inhibit cell proliferation and induce apoptosis. Now, studies also show there's a significantly reduced rate of breast cancer in people who regularly eat flax. And if you get a tumor growth, it doesn't grow very fast. Flax seed is also commonly known as linseed. And as we know, it's cultivated mainly in Asia, Europe, and in the Mediterranean region. And there are brown and yellow flax seeds, and the brown ones are actually more healthy. They're both delicious and good for you, high in fiber, etc. But when it comes to the cancer-fighting stuff, it tends to be higher in the brown. And it has a lot of omega-3 fatty acids. And it's one of the main sources of essential fatty acids from plants. So if you're not wanting to do fish oil for any reason, it doesn't matter why, this is a wonderful substitute. And it has the lignins and minerals such as magnesium, phosphorus, and calcium. And it's very high in dietary fibers, and it's high in vitamins A, C, and E. And it has approximately 800 times more lignins than other plants, and they do all kinds of things. And one of the most important things that flaxseed does is if you have excess estrogen running through your body, which most of us have because there's so much toxic estrogen in our water system, because our water doesn't take out hormones. Water treatment usually doesn't take out hormones. And there's lots of people on birth control, which are urinating into the sewage supply. And, the sewage is eventually purified for drinking water. And there you go. So what the lignans do is they help the estrogen not go back into the blood system through the colon. So that's why it's important to eat a lot of fiber in your diet if you want to prevent breast cancer. And most of us, whatever is excess in our system, we tend to excrete either through our urine or through our feces. And if the feces is sitting in your colon for a long period of time, there's estrogens in there and they actually penetrate your colon wall and go back into the blood system. And you don't want to do that. And that's why fiber, but particularly lignans, are important. And also, an aside, any type of fermented food, such as yogurt and sauerkraut and miso, things like that, is very important because the lactobacilli also help the estrogen not go back into the system, but out through the feces. So flax seeds are wonderful ways to do this. And I make my own flax seed crackers. They're very expensive to buy and they're so yummy. You can go through like a $10 bag, which is about 30 crackers, or for $2, you can make quite a few crackers and you can do all kinds of things. And a lot of the gluten-free breads and vegan breads use ground up flax seeds. And I'm telling you, these breads are just delicious. There's no lack of recipes or YouTube videos on how to do that. Now, the next herb is called black cumin or Nigella sativa. And most of us have tasted this delicious spice when we go out for Indian food and the cracker bread has little flecks of this. And I just love this stuff. It's so yummy. And the active constituent is called thymoquinone, and this induces apoptosis, and it also has anti-metastatic effects. And what's really interesting is the oil. You can get infused oil of this, and it reduces the risk of skin burns due to radiation therapy. So I think that's kind of neat. If you don't mind smelling like curry, this is really a nice thing to do. Now, there are over 100 bioactive compounds present in the seeds of black cumin, and the 4 pharmacologically significant ones are thymol, thymohydroquinone, thymoquinone, and dithymoquinone. And there are a number of studies that have shown that thymoquinone inhibits the creation of tumors. And it does this through various mechanisms. It could probably take hours to explain how that does that, but who cares, right? Eat something delicious and it inhibits tumor growth. And there is evidence that in vitro applications, which means you eat it while you have the cancer, it induces apoptosis. So this is a yummy thing. And again, I have a link in the notes on how to cook with this stuff. And you should be able to get this in Asian stores and Indian stores and Arab stores. Now, green tea, the proper name for this is Camellia sinensis. And it's a specific way of producing and drying the leaves. Sinensis basically means Chinese or Asian. Camellia is tea, and it's green tea. Now, here's a wonderful word for your Scrabble game. It's called epigalactocachin, 3-gallate. And what studies have shown is the more you drink this stuff, the less likely you are to get breast cancer. And there's really interesting studies of breast cancer incidence in women from numerous Asian countries, specifically Japan. and they might be incredible smokers, but for whatever reason, when they move to America, they start developing breast cancer. And it's mainly because they're not drinking as much green tea as they used to in their homeland. So, and they've also done horrible experiments on rats with green tea and putting breast cancer and lung cancer cells in these poor animals. But if they feed them a ton of green tea, they don't develop cancer, which I think is a good thing. And it also has been shown to protect against breast cancer. It also shows to prevent recurrence of breast cancer. So if you've had breast cancer and you're a survivor, drink this tea. And if you take it on a regular basis, and then you're diagnosed with stage 1 or stage 2 breast cancer, you have better prognosis. So just drink this stuff. And it has many bioactive polyphenols, and it also has a lot of caffeine. And when I drink this stuff, I'm awake, like I'm super awake. So I can only drink it in the morning. And the polyphenols consist of flavonoids, flavonodiols, flavonols, and phenolic acid. Now, if you can only choke down so much green tea for whatever reason, a great way to get this stuff into you is through something called matcha. And matcha is a green tea powder that's made from shade-grown, grounded Camellia sinensis tea leaves. And these tea leaves, these shade-grown tea leaves are called tencha. And this gives this powder its umami flavor and high caffeine content. And a lot of people throw this in their smoothies. If you're like me and you just can't help yourself, you make chocolate with matcha in it. And you can make matcha cookies, matcha ice cream. But the best way is, in my opinion, is to throw it in a smoothie. So it's very wonderful. So however you can introduce these food items in your diet, whether or not you have breast cancer or you're in remission or undergoing treatment, these herbs all have proven positive effects, not only as preventatives, but also while you're undergoing treatment, and also afterwards in terms of healing. They're also delicious, which for me is such a lovely gesture that nature provides a scrumptious way to be healthy. So this is Stephanie Georgia saying thanks for spending your valuable time with me. This special edition of the Botanical Medicine Study Course is a small taste of the complete course, which will come out in January 2024 in terms of the Herbs for Women section. Again, click below on the link for a free introductory video lesson and handouts. And don't forget to check out the recipe links. I hope that all the women in your life are healthy and happy, including you, if you, dear listener, are a woman. I also want men to be healthy, but it's Breast Health Awareness Month. Now, until next time, be well.